Good morning, good afternoon, everyone, and a very warm welcome to the Amar Ujala Healthcare webinar. I'm Sumit Chaudhary from amarujala.com, and it's my pleasure to host today's insightful session on technology, trust, and treatment, the new pillars of India's healthcare. At Amar Ujala, we believe in delivering conversations that shape India's healthcare future, where innovation meets impact and inclusion. Same as healthcare in India is undergoing a transformative shift from digital health solutions and AI driven diagnostics to patient centric care models and trust based healthcare delivery. Technology and transparency are redefining the ecosystem. Today's webinar will explore how technology, trust, and treatment together form the foundation of a resilient and future ready healthcare system. We are delighted to have an esteemed panel of industry leaders and experts who will share their perspective, experiences, and insights on this important topic. The session will include panel discussion, audience question and answers. We encourage all participants to post their questions in the chat box. Same as it is now our honor to introduce my distinguished speakers. We are starting from Mr. Prem Kakkar. Mr. Prem Kakkar is a CEO of Park Group of Hospitals, a seasoned healthcare leader with more than 40 plus years of experience in advancing hospital services and patient care. We are delighted to have you with us today, sir. Thank you so much with us. It is
Thank
now
you,
my
Smith.
honor to introduce our distinguished speaker, Dr. Ravi Gaur, Chairman, Medical Advisory Committee, Onquest Laboratories Limited, and founder, DRG Path Lab, 30 plus experience in diagnostics and healthcare innovation. We are delighted to have you with us, sir. Thank you so much with us.
Thank you.
It is my pleasure to introduce Mr. Saurav Gupta, also a dynamic healthcare CXO and regional director at KIMS Hospital with a proven track record across Medanta, Fortis, McKinsey, and PwC. We are delighted to have you, sir, with us. Thank you so much.
Thank you, Sumit.
And now it is my pleasure to introduce Dr. Rashmi Gupta. It is a healthcare leader and clinician currently serving as managing director and business owner at Felix Hospital and Healthcare with extensive experience in clinical practice, healthcare leadership, and patient-centric care delivery. We are delighted to have you, ma'am, here. Thank you
Thank
so much.
you. Thank you. Thank you, Sumit.
Thank you, ma'am. Now, I would like to invite our panelists to join the discussion and we explore key challenges, opportunities, and future trends in healthcare innovation and patient centric care. Let's move on. I would like to invite Mr. Prem Kakkar to share his insights on. Sir, my first question is what challenges do hospitals, leaders face while adopting new technologies and how can they be addressed effectively, sir?
See, good morning to everybody, panelists and listeners, and thank you, Sumit. Institutions, that is the hospitals, always keep facing challenges. New challenges emerge every other day. There is no institution who wants to deliver substandard care. And to deliver the best care, you really need to upgrade yourself. Now, as you decide to upgrade yourself, you need to introduce newer and newer technology which is being used, be it in the Western world or be it in use by your own competitors in our country. When you need to bring in newer technology, cost becomes a major factor. Healthcare budgets generally are allotted on annual basis. They have their own limitations, and the healthcare leaders are expected to provide every good and bad thing or bad aspects at any point of time within that budget. Budgets are decided generally in corporates, and the healthcare leaders have to ensure that they do their best in the budget. Now, what happens is a consultant comes, he wants to introduce new technology, he gives a reference, so and so institution, and I'm wanting to do it. So it is one, the budget. Two, when you want to go in for budget, it is not only the initial budget which is required to buy a particular item. I'll give you just an example. Every institution today wants to do a robotic surgery. Now it costs. Robotic surgery has an initial cost. It goes in CRs, maybe 4 to 8 CR, depending upon what model you buy. The software needs to be upgraded at any point of time. Instruments which have to be bought for different surgeries during the surgery. So initial cost, additional cost during the maintenance, CMCs and AMCs, that is the maintenance contracts, they themselves cost quite a lot. And then comes the training aspect. You need to ensure that training is done on regular basis. When you introduce these technologies, they will require a change of infrastructure. Maybe you need to add up infrastructure. Once again, the cost is involved. So the major factor that comes in is cost. Then you need to train the staff. You might acquire something and the staff may not be trained enough to handle it, or there can be an accident. Anything and everything that you need to do has to be patient centric. You have to ensure that patient benefits, the institution benefits, and during the system, whatever institution has, it really amalgamates into that system. Now, many institutions today will have a level. You see, let me talk to you about surgery as I'm talking to you about robotic surgery. Initially, we used to do open surgeries. Then in came the laparoscopic surgery. That meant involvement of equipment, instrument, training, and all that. Now everybody wants to go in for robotic surgery. When you want to go in for robotic surgery, you need to accommodate that robot in your operation theater. That means you need to modify your infrastructure. That means you need to have more area in your operation theater. You need to connect internet in that particular theater. You need to be connected with the system where the Da Vinci system, if it is there, monitors everything. So, infrastructure, initial cost, ongoing cost, and then you have to ensure that whatever data you obtain, that data needs to be protected at every time. And once you protect the data, you need to connect with the IT people. Now, when you are upgrading your system, another problem that comes in for leaders is resistance to new technology. Our consultants, they particularly at a particular time, they are used to a particular way of doing surgeries. You introduce something new, initial resistance comes because they've got a system. They feel new things will come, it will interrupt their this thing. I'll give you one example. Almost now 3 decades back, when the laparoscopic surgery came in this town, I'm talking of Delhi or NCR, there was a huge resistance from those who were actually doing open surgeries. Some of them were doing with the minimum incision. So they used to say, I'm an anesthesiologist myself, so I used to talk to my surgeons. They will tell me this thing that we're already doing with small incisions. Where is the need for this? Gradually, they realized when the patient started to come and tell them that हमको दूरबीन वाली surgery चाहिए.
Hmm.
Then they realized that they have to learn this technique. Now, in robotic surgery, again, you need to qualify yourself, you need to train yourself. And if you have not done that, you cannot do it. Your internet system have to amalgamate with the existing system. So is the IT. So information technology really need to, you know, integrate with the existing system or improve themselves so that they are able to deliver what exactly one needs. The other aspect is the workforce readiness, those people who are actually getting involved. You may introduce a robot in the system, you may train your surgeons. If your technical staff is not in a position to handle, you will find it difficult. So you have to train everybody. And when you train, you have to ensure that the appropriate training is given at all levels. The doctors are trained in a different way, technicians are trained in a different way, the anesthesiologists are trained in a different way, and the nurses too are trained in a different way. Ultimately, it is the teamwork. The training has to be ongoing. So the factors which I have told you is this: initial cost, on-job training, prevent resistance, upgrade your system, and then ensure that you have got a good IT backup, which may also need to be connected with any other company in case it is required. So these are the things which generally come in day-to-day life.
Bilkul. Thank you, Mr. Kakkar, for the valuable points you shared. As you rightly mentioned, cost is a very significant factor in the healthcare system. Let us move on to Dr. Ravi Gaur, sir. Share your insights, please. And my question is from a diagnostics leadership perspective, how is advanced laboratory technology transforming early disease detection and personalized treatment in India?
Well, good afternoon, Sumit, and pleasure being here and talking to something which is very important today in the era of technology, because technology is behind everything. And how do we, anything which is like supportive, we need to trust the most. I think from a diagnostic point of view, basically, I'm an oncopathologist and a pathologist diagnostic. One thing is very important that for us, every sample is a life, because we hardly see a patient, because most of the time, patient don't walk into our center, or in the hospital, the sample comes to us. So I think every sample is a life for us, and behind every accurate report is a silent promise to protect a life we may have never meet. That's a fundamental principle. Now, from the technology point of view, I think we have fairly advanced, because today, technology is allowed almost like trial and error medicine to evidence driven precision. That is something definitely is there today, and everybody wants to practice that evidence based medicine. That's the right way to practice too. And what how much advancement has happened, probably I have to say, from the reactive confirmation. Like earlier patients to come and you have to like just okay something we guess and then guesswork and confirm test on. Today it's a predictive intelligence. We can actually predict in advance this is going to happen, this is what it leading to be tomorrow. There's a small illness today, how will it progress? I think that also is fairly predictable today, and that's the technology point of view. you know uh, Early detection is no longer the fundamental thing in any disease. Early detection, especially in cancers, where you can detect early, it's almost curable. Any other disease for that matter. So it's no more of finding a disease today. We can do that. A lot of advancements happen. It is identifying the risk before symptoms appear. I think that is we have extended to that image now. Today we are seeing high throughput automated platforms. This highly throughput. Within 2 hours we can do 200 assays or multiple sample testing from one assay, and reducing variability. Otherwise, there's a lot of variability into this. Then molecular genomics have come, because disease at the genomic level we can identify. We can identify the genes which are mutated, which are affecting, how we can work on them. That has led to target-based therapies, because a mutated gene therapy is absolutely targeted, and precision therapy we are hearing today. AI assisted, because artificial intelligence, because it's digital pathology. The patterns can be seen, and AI can tell you, because biopsies is a fundamental thing for a cancer diagnosis. It's all still seen by eye and subjective expertise. So AI can highlight, okay, you may have, because if you see that almost like there's always a second opinion required in a cancer biopsy reporting. 20% of patients actually need a, you can find some variability, and AI helps us to bridge that gap. So I think it's become an assisted, augmented tool for a skilled pathologist to use that AI. Now, again, one thing we always talk in diagnostics is turnaround time. That is, we were defining today, it's been redefined now. Turnaround time means the patient sample comes to my lab and I deliver the report. But today, because of the technology which is getting integrated across, the turnaround time has become, CAT, not TAT to CAT. That is clinical action time. Turnaround time doesn't matter, because as long as the report has not reached the doctor, from the sample pickup to the report delivery, I think that is what, because the report has reached, treatment start. You may have done test in 2 hours, it is not reached doctor, sample is not reached you in time, it is not what a much benefit, and technology helping that gap also. So, I mean, I think we talk about molecular oncology, pharmacogenomics, I mentioned about biomarkers based screening, and this is where, we have a technology really transformed into personalized treatment in India. Now, that's one important factor we are all working forward, and we're all looking. Now, the problem is, because here is the how do we provide the services across tier one, tier two, tier three, and this is the biggest challenge today we have today. And how do we kind of make sure that the quality is across, because we don't have a standardization, to be very frank. We and it, how only 5,000 labs are anyway accredited. There's people, there were 200,000 plus pathology labs. And with 20,000 pathology in the country, how do you work on that? And that's, you can understand the bigger challenge. And accreditation is still a voluntary, it's not a mandatory process. Running internal, external quality control, nobody knows who was running that. So many instruments, there's so many variety. Only thing one is standardized, that is on the our, we can call it as our reference reports probably, because that's defined by WHO. India has adopted that World Health standardization. But I think India need to develop own standards, which technique to use, which methodology to be used, because there can be variation reports. One automation instrument, another one, everything can vary. I think standardization is one. And again, I'll still not, automation helps definitely, but I think without human oversight and trained expert, it is going to be a problem many a time. Sometimes automation is just something which goes on. We use AI, automation, automated intelligence, or artificial intelligence, but it can also be sometimes turned into, if you don't use an actual intelligence, by using all this, it could be. I mean, it can be, if used, it be awesome intelligence. If you don't use, it be, sometimes it can be an awful intelligence too. Now, I think these are the important factors what we feel that today. So ultimately, I think what we need today is, the reliability is most important part of us. And I think it has to be a culture driven, not a compliance, because you have a, like, okay, this is a rule regulation you follow. How much you can, I think that's what the leadership fails today. We make to drive a culture of quality, 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 ensuring that as a diagnostic, you don't see the patient, you see a sample. And for me, the sample is alive. So you have a not a really a compliance driven is okay, everybody can do that. But I think more the culture has to come right from the sample pickup from the periphery, because today it's, sample have been transported right across country from one place to another place to multiple places. Now, how do you maintain the temperature? How do you standardize which is the referral lab, secondary lab, and a primary lab? Near patient testing is fine, but how there's so many point of care instruments which are validated, calibrated. We don't know where is the alert, and is somebody, there should be some centralized portal. There has to be somewhere taking alert of all this. The real challenge, expansion is fine, but the real challenge for the leadership is it's expansion without the dilution of quality. So I think growth in diagnostics has become very easy. Everybody takes diagnostic, too much of required. Yes, without that, nothing moves today. But I think standardized growth is a leadership. And this is what I like to put across today. Easy to work, but difficult to standardize. Put an effort, make a culture, the compliance, ensure that everything is automated. Never have a human oversight missing. Human being has to be there, and for all point of view. That's what my thought for today.
Well said, sir. And it's important that healthcare is in technology is playing a crucial role, but manpower is also very important. Improving patient outcomes and pathology is emerging a key pillar in this journey. In this context, the insights shared by Dr. Ravi Gaur are extremely important and valuable. I would like to invite now Mr. Saurabh Gupta to share his insights on what role does transparent communication play in strengthening the trust between the hospitals and patients, sir.
So, good morning, and thank you, Sumit, for having me here, and thanks, Amar Ujala, for actually discussing something very pertinent to the current scenario. Now, when you talk about communication, communication is very important because there are three factors. If you see communication, um, it is further most important in healthcare settings because there are a lot of times when the product or services in hospital are not as standable as a hotel or any other commodity. So patients sometimes do not know whether, if you are doing good. The results take time because there is a process of treatment, so it is very important to communicate. Second thing is, hospitals are not nowadays, especially in the VUCA world, only judged on clinical outcomes. You need to tell how clearly a patient is progressing or there is some issue. Timeliness is important. And the third most important thing is communication in the current scenario goes much beyond the patient and the hospital. There is an extended family. There are a lot of stakeholders. There are, licensing authorities. There are media houses, there could be an important person, and there has to be an update every say hourly or daily. So it is very important for you to actually communicate for a hospital. Now I was hearing Dr. Kakkad, he was talking about robotics. Now this is an excellent example why communication is also important, because communication is not only to tell about the current scenario or current condition of the patient. Suppose things like robotics. Now robotics is something, if you do a robotic surgery, the additional cost will be around a lakh to 1.5 lakhs, depending on the type of robot and type of surgical arm used and the consumable. Now lot of these insurance companies do not pay for that, and there is a constant struggle between the traditional surgeons and the current robotic surgeon. So the patient at times do not know what is good for them. So now it's the onus, the communication is the key. The As a hospital, we need to also educate patients and the society what are the benefits of the robotic surgery, and why giving some extra money will actually help, why the success is better, why the recovery is better. So this is an excellent example why communication goes beyond just the patient and the hospital. Now when you talk about communication, there are three T's for communication. One is the treatment, consistency and clarity in treatment, and I'll speak more about that. Second thing is the transparency in costs, which is a big taboo in India because everybody says that hospitals overcharge. And the third thing is the trust which is built through extended communication. Now coming to the first thing, which is the treatment clarity and consistency. Now we all are sitting in healthcare because the patient is there, and patient comes in the ecosystem because of treatment. So treatment is the core product for any healthcare provider. And it's not only important to actually treat him right, you need to tell at various stages. So what is the diagnosis, what is the prognosis? And Dr. Gaur has already spoken about the laboratory sciences form the backbone, and any critical results should be immediately not only communicated to the doctor but also to the patient regarding change in the scenario. uh, Anything concerning the choice of intervention, or going aggressive or conservative, that also option should be given, because patient should have the authority to choose whether, for a say ischemic heart disease, there are various thoughts like heart blockage in current normal terminology. um, People, there are chances when people say go for a PTCA, which is like angioplasty, but it can also result in, there are of course guidelines, but there are scenarios where you can give choice to patient of going into a cardiac surgery versus PTCA or even conservative treatment. So those choices with risk should be communicated very well to the patient, and it is not only let the doctor decide what is the best for the patient. It is basically let the doctor, patient, and the extended family decide whatever is best based on various pros and cons. So this is very important. And there should not be any sudden surprises, because what happens, there are a lot of black boxes, as we call it, in the hospital, which are operation rooms, ICU, ER. Because majority of the high end clinical work here happens here, but we fail to actually at some time tell the extended family, and in some scenarios the patient what is happening, like a surgery was for 2 hours, and it extended beyond 2 hours, it went to 3 hours or something. Now patients, attendants who are sitting outside, they're very anxious, what is happening to my patient, what happened, something is not correct. So periodic interval communication, timely communication is very important. uh, Access to records should be there, and it is a right of the patient to have access to records. The second thing is the cost transparency, because a lot of hue and cry we can see about overcharging, and the major issue is the difference between the estimate and the final bill. Now this has been an issue, and it is actually a trust broker, There are a lot of instances when, because in healthcare it's not pure arithmetic that 1 plus 1 will be 2. There are a lot of chance places where treatment course changes, more additional surgeries, additional consumable or stay adds to the total cost. Now there are two things. First of all, it should be minimized to actually add anything to the patient, but wherever it is imperative, we should actually timely tell the patient that this is what is happening, because in India 60% of the healthcare is still financed by out of pocket, and any 20% 50% addition on the bill might actually mean that the patient family will have to literally arrange fund. They might even have to borrow. That's the reality, which will be a big trust bigger, and it will be a huge issue for the family. So that is one thing which we should all understand. uh, Also, consistency in the communication. So what has happened is, in some of the hospitals we have seen that the uh, package rate or the estimate actually changes from doctor office OPD to admission and the last bill. That should not be there. Standardization of billing codes and also the estimate should be there. The entire hospital should say the same thing, because once you start talking in a different thing because of lack of training or whatever, it actually leads to lack of trust or a breach of trust. The third and the most important thing is extension of trust through communication, as I was talking about the extended stakeholders, the family members, your society as large, licensing authorities, government. So it is not just important nowadays in VUCA world to do good work. It is very, very important to communicate, first of all, what new technologies are there, what are your success rates, is there something which really helps patient heal in a better way, faster way, sometimes cheaper also. However, it takes time. When new technology comes, it is expensive, but over a period of time, the cost of the treatment comes down. So that communication has to go. And in terms of digital, there is so much which can be done. And there are a lot of hospitals which have started publishing even the success rates and what all good they do. Also, hospitals are a community organization, so it's our fundamental duty to tell about various hazards, any any disease which is spreading, how to stop them, how to get better treatment. So in a summary, I can say that communication is a tool, and by doing it prudently and timely, hospitals can actually bring trust in the system, and also it can lead to higher patient satisfaction and overall system success. These were my thoughts.
Absolutely. Communication with patient is extremely important so that they can clearly understand the treatment, also know how it will benefit them. As Dr. Saurabh Gupta rightly said, it acts as a bridge between doctors and patients. Thank you, sir. Thank you so much. Now I would like to turn to the only lady in our panel. Thank you, ma'am, for your patience. And I want to put your insights on how can AI, telemedicine, and digital health platforms improve patient care?
Thank you, Sumit. And thank you so much for inviting me in this important discussion. That this is the important discussion of the era, actually, because now we have reached a certain level in healthcare. Means machines have been very much upgraded. Radiology diagnostics has been upgraded. Lab diagnostics has been upgraded. So now the role of AI has come in, so that we can even go to the further levels in diagnostics and the treatment. So as in this era, AI, telemedicine, and the digital medicine, it has an important role to reach to the tier 2 and tier 3 cities. As we were discussing, the most of the healthcare is concentrated around the tier 1 cities only. As of now, the Indian scenario is. And our 70% population is residing in the tier 2 and tier 3 cities, the village areas, which are far from the healthcare services. So, as far as AI is concerned, it is very much has a very much important role for the diagnostic and the predictive and preventive purposes for rather. As in this current era, as we see, the life expectancy has increased. It is more than 70 years. So the chronic diseases are emerging. The lifestyle diseases are getting more and more into this scenario. That very much the cancers are emerging. Cancer is now a very fast growing disease of this era. So with the help of AI, what we can do is we can predict the diseases now. So there are, but it has have a very important role to support the doctors. AI cannot replace the doctors anywhere. So it can support the doctors and can make the diseases to be diagnosed far early, to be treated, as we talk about the cancer. So with the cancer, always the scenario is as early as can diagnose it is treatable. So when the doctors, when the diagnostics, they have a certain limitations where very minor changes which got missed or which cannot be appreciated, but AI can support us to find out those factors and to predict what disease can come up. Because with so much of exposure with AI, it can make an accurate diagnosis timely, so that the preventive and the curative measures can be taken on time, so the lives can be saved and quality of life can be improved. This is the very important role of AI, which we should be taken as an advantage, and we should learn it to how maximum use can be taken out of this AI. And the other important thing is it can make an accurate diagnosis. Many a times there some small things can be missed out, which AI can capture and make an accurate diagnosis timely, so that the treatment can also be tailored according to the patient's genetic framework. So the outcomes can be quite good. So we have to be very much open to AI. We must make up ourselves to train ourselves to the use AI into the system. It is, but we have a fear that it can replace the doctors. It cannot happen anywhere. It cannot even happen just because AI can support us. AI cannot replace the human touch, the human intelligence, but it can support to make the healthcare far better. Because we are not, as of now we have just entered into the predictive medicine, but with the help of AI, the predictive and preventive portion can be a very big benefit to the healthcare, and it can reduce the burden of the diseases in the healthcare system also. So this is something which is very important as far as AI is concerned. So, and if you talk about the telemedicine, so telemedicine is a real tool, so by which we can reach to every corner of the globe, rather. As we have seen during the COVID era, that with the help of telemedicine only, we have reached to so many of the patients, and we have treated so many patients with the help of telemedicine only. So we can reach to the tier 2, tier 3 cities far.
Oh, I think we have got disconnected to Dr. Rashmi. We are trying to reach out once again to Dr. Rashmi. Further, we are moving to Dr. P.N. Kakkar, sir. I just want another question to you, sir, on the regards. So, with increasing transparency and informed patients, how can hospitals build and sustain long-term patient trust, sir?
Oh, that's a very important question in the modern context. You see, there used to be a time when doctors were gods. After certain legal interventions, that is the CPC Act came, doctors are no more gods. Now, there is a famous saying, in hospitals, When a patient walks into the hospital, he says, "You are God." Now, after a surgery is done or patient gets better, they say, "You are a human being." And when the bill is given, then they say, "You are not a human being, you are a devil." Now, that is exactly the situation. So, when I say these words, today doctors are no more gods. You need to build your trust with the patient by delivering continuous quality. So, whatever you do for a patient comes in troubles to the institution, you need to explain to them what is wrong with them, deliver quality care, and gradually but surely build trust. As the previous speakers were talking about, the cost factor. The cost factor needs to be very well explained to every patient. You give them a certain jerk that we told you a package of 1 lakh and you give a package of 2 lakh, the trust goes. Whatever you may do, your patient might get better, but yet he's going to curse you. So it is a proper communication at all levels, delivering quality care consistently, communicate with the patient at every level, and build trust slowly. You may have a brand image, but your brand image is going to be built further by the patient. In my dictionary, every patient who goes out of the hospital, he or she goes out as the ambassador of that institution. He or she is going to talk about what has been experienced. If it is a good experience, they will do your publicity. If it is a bad experience, then also they will do publicity. So the trust factor is by delivering quality, proper communication, and transparency. These are the three most important factors which you must give it to your patient to win their confidence. Does that answer your question?
Yes, sir. Thank you so much.
Yeah.
And we have Dr. Rashmi once again. Sorry, ma'am, for the technical error. You have got disconnected. Ma'am, you have raised
Yeah.
very important point regarding the AI and the telemedicine. Please continue with your thoughts, ma'am.
Yeah. So as far as that we are discussing about the telemedicine, so for telemedicine is having quite an important role even for the tier metro cities as we are residing into, because there are so many factors, the distance factors, the we are engaged in so many things. You are into some profession, so you cannot reach to the hospital. So by that, with the help of telemedicine, you can connect to the doctor anywhere at any time. Means telemedicine is available 24 into 7 for your help. So this is quite an affordable as well as accessible system, which can by which you can reach to the doctor anytime and anywhere. You can take the cross references, you can take some second opinion with the help of telemedicine, and even far cities, even tier 2, tier 3 cities, these people can connect to the specialist doctors also with the help of telemedicine only. So it creates a convenience even for the as far as compliance is concerned. For that also telemedicine is quite important, as the people with the chronic diseases, means hypertension, diabetes, or some neuro disorders, in which the people want or they have to have a regular follow-ups and timely follow-ups. So with the help of telemedicine, if nobody is there to support them and to take them to the hospital, so with the help of telemedicine, they can take the consultations sitting there at their home, and compliance can be better. So this all is very important, and even right now that the home care system is also a part of telemedicine as well. Means you can set up a ICU at home, and with the help of telemedicine, you can monitor the patients, the critical patients, the terminally ill patients, in which you have to provide a palliative care only. So for them also, for their families and their support system, it creates a good support system for them. They can be taken at home at their ease, and palliative care be provided to them with quality. So the telemedicine in these days is a very important pillar of healthcare system to reach to every people of the society, to every people of the strata, and all across the globe, which can improve the quality of the care as well. And the third part, there was something we were discussing about the digital platforms. So the digital platform is important for the patient records also, as if it can improve the accessibility to the patient records. The patients will be everything can be on portal, everything your all the reports, your all the data can be on one platform. It can be carried with your smartphones, so that the patients are also educated and aware about their health records, their reports, their treatment lines. In Indian sector, this is a common problem actually. The people don't know where their last prescription is, what they were taking earlier, and what was their diagnosis, what were their report findings earlier. So if this electronic record is available, so it can be accessible from anywhere, and it will create a transparency of treatment also, even as the government is creating the ABHA IDs. So this is an initiative to integrate the system, to integrate the health record of the people, so that end-to-end care can be provided to the people, and the whole record from the initiation of the treatment till the end of the treatment will be available to you. It becomes easy for the doctors also, for that regard, that they are knowing each and everything on one portal. The all whole the record whole record of the patient is available over there, to see what progress of the disease is and what they need to modify and alter. So in this era, AI, telemedicine, and the digital platforms, this whole system is creating healthcare a better, with the better results and accessible to people, and rather more transparent too,
Yeah.
because all the data is available on one portal. Anybody can see and anybody can cross check with the some other references or something. So it has revolutionized the healthcare. Now we can see it has revolutionized the healthcare in the last few years with the help of AI and as well as the digital platforms. We can make everything paperless. So this is a very good advantage and support to the healthcare, which can reduce the burden to the hospitals as well. So
Yeah,
yeah,
thank
this
you,
is my
ma'am.
point.
As Dr. Ashu mentioned, AI and telemedicines are and digital health are extremely important in the healthcare sector today's scenario. Now, I would like to turn to Dr. Ravi Gaur, sir. You spoke about the challenges in the diagnostics. I would like to understand this in a bit more details in this. What challenges do diagnostics leaders face while scaling high quality testing services, sir, across the diverse geographics in India?
I think very relevant question. And before I answer that question, let me just, where you just mentioned about AI and our trust. I think what is inside the black box, I think that's very important, and that's built the trust, and that's what I think matters to me, whatever it is. And everybody is saying that we have to validate what is inside the AI before using the AI, and that will build up the test. Nothing, and AI is of course required today. You can't get away with it. Now, coming to your question, actually. Scaling in India is, today, if you look at the diagnostics, is an opportunity, but it's very complexity too. Because, firstly, infrastructure variability. Urban versus tier 2, tier 3. You can have best of diagnostics in bigger cities, tier top 10 cities. Nobody will step out 200 kilometers from Delhi. You will not be able to find the basic, even a basic done correctly. What to talk about molecular biology, genomic, predictive, that is really not there because there is a infrastructure issue. There are problems about Dr. Pakar mentioned about internet issue, problem electricity issue. Then there are shortage of skilled people. We don't have the manpower actually. You also mentioned about trained technologists. Where do we have trained technologies, and people need to keep upgrading themselves, and there is a system involved into it. It takes time. The biggest, like one number we mentioned, about 200,000 plus labs. We have only about if 20,000 pathologists, maybe similar biochemists, maybe microbiologists also. So ultimately we're still short of almost like, you know 100,000 people. Now, how do we work on this? We all depend on technicians, the paramedical forces. The paramedical forces of equal quality, training in the country and health. And the technology is evolving very, very fast. You need to continuous upgradation. That's is a very big challenge today, the skilled manpower. Come what may, especially in tier 3, tier 4, you just don't get good people. Good, even basic people are not there. You work very hard. And moment you train them, probably they move towards tier 1 and tier 2, better revenues, better revenue, better profession, and probably they're good paid also. Now, again, the problem is okay, you want somebody logistics. Now, today, one thing is developing in diagnosis is a logistics chain. Samples are being transported, right, even drone. We're using from various part of Himachal Pradesh. Samples are reaching in 4 hours. but sample has to reach. A sample should not deteriorate in between. There has to be cold chain, has to be maintained. It has to reach timely to a place. It has to be monitored. Like we monitor our, probably a food from Zomato. Where is the reach? How far is it reaching us? Do we monitor our samples? What in between? Maybe temperature has gone up, turned down. Who knows? I think that technology is nothing important. So logistic and cold chain, simple stability across long distances. It's a new opportunity. People are working on it. Bigger centers are working on it. But I think a lot of shipments are going right, left, and center. Not only Delhi to Mumbai, wherever it is, but maybe internationally sometimes. So it's very, very important. Then cost sensibility. Now balancing the affordability. Big, maybe this across the scenarios. This is again some people in bigger somewhere people are the cost per income per person is much higher in some cities. Some probably you can afford, but what happens where they can't afford it? So how do you balance the cost, giving the same quality, same standards, same? I think this is another big challenge for leadership, and we're all fighting it hard. I think new devices, make in India devices, making something which is going to work a lot. Now, regulatory uniformity I mentioned about, maintain again, regulatory, because there is no really speaking. You look at the NABL is the only body in the country today diagnostically, which is actually global and the best accreditation authority. But really, how many labs are accreditation? COVID time, we had about 4 to 5,000. Today, they're almost similar number. We have not increased. We try to work hard everywhere. Hospitals also, Dr. Kerr will agree. NABH has now gone up very, very far. But NABL still going slow. But I think we need to do something. We need to adopt, make sure that every lab is registered. At least they participate under some quality control program. They have a right kind of automation, standardization, SOPs. I think this is another area which is a big challenge. We need to do a lot on it. Then the other area would be like how do you work? It's not like challenges are everything. I think we need to how do solution also exist. I can suggest create a hub and spoke model from one. Maybe today that's bigger labs are doing. We have central lab, we have regional lab, we have satellite lab, and we have primary. From one place, whatever required in 4 hours can be done locally because we have now point of care testing technology. We have handheld devices which are integrated via technology. Even centrally sitting in Delhi or Mumbai, you can see which device is giving which value. Have they maintained annual maintenance contracts, comprehensive technology? If the strips have been stored at the right temperature or not, all this can be monitored. But I think that is where we need to integrate, use technology, and then we use technology. We will have to develop a trust first, and then, of course, based on our trust, I'm sure when we are because India is still always doctor-driven healthcare people. Is doctor trust? Okay, fine. Patient trust. Doctor blindly, and the treatment starts there, and that's exactly the answer. Standard protocol, digital integration, continuous program. These are certain important, answers. I like to say that. So, in the summarize, I like to say that one important factor is also coming out. Technology is the challenge is the data because so much integrated, so many software, so many systems, limbs, window based. Nobody knows what is happening right, left, and center. I think this is again DPDP Act has come trying to standardize a lot. Hopefully that should work. But I think once cyber security no more an IT issue. I think it is a patient trust issue also. So and it's very important is like we need to have a proper software, proper limb space, audit trail. Everything has to be there. Control has to be there. Patient consent has to be there. Audits have to be there. And I think from a diagnostic point of view, data for me is like patient's dignity. If you have a patient dignity, you should maintain that. And this is another big challenge today we all face. In summarize, I'll just say that like few lines. Technology empowers, treatment heals, and trust reassures. So when you put into the 4 lines, I'll say technology may enumerate the path unseen, but trust is the light patients lean on in between. Treatment begins not with a needle, but with a belief, because the patient comes with trusting a doctor. Treatment starts not with a little bit, but belief in hands that hold both science and relief. When data is guided by dignity, healing becomes a promise we all share. I think that's very important. Challenges are there, but I think take our ownership, take responsibility. We have a lot of industries doing, government also doing a lot of work, but I think everyone has to come together and collaborate, use each other, and do validate technology, trust, and I think community awareness, patient, I think will be role is very, very important. Put them together, I think we can reach where we're heading for. That's what my thought.
Well said, sir. And as you mentioned, there is some challenges, but there is a solutions also. Now, I would like to come to you, Mr. Saurabh. As you pointed out, communication is a very important. But how do multi-location hospital groups maintain consistent quality of care across regions?
Right. So, Sumit, I'm happy that you asked me this question because I actually represent Krishna Institute of Medical Sciences, which
Yes,
is
sir.
actually, one of the largest hospital groups now in India. It is actually, if you see the market capitalization, it will be around sixth or seventh. We manage 25 hospitals in Western and Southern India, and
Hmm.
we have more than 6,000 beds. So, we actually face these issues day in and day out. So let me start with saying that there is no McDonald's model of healthcare or hospitals, and the cookie cutter approach cannot work. So hospitals are very different, and they need to be localized. However, we have done something that majority of the prominent organizations do such things. So one is the standardization of the core clinical protocols. Now, what I mean by this is we have one clinical language, and we have experts at the corporate who define what the evidence based protocols for the key interventions or medical treatment will look like. So there is a central governance council, for example, treatment protocols for stroke and myocardial infarction, heart attack will be almost similar at any of the hospitals, and including the TAT times which we are monitored. So door to balloon time, that would be monitored, and other things. Plus, these protocols will be resembling some of the best evidence based protocols in the world. So they will have their international clearance. So that is one. Second thing is we have standardized governance uh, protocols and survey system. So what I mean by this is we do regular audits. So there is a central team which goes, KPIs are defined. There are clinical as well as non-clinical KPIs which are defined. There is an agreed framework, and that is adhered to. So daily, weekly, monthly, these dashboards are sent, they are monitored for consistency. And there is kepa which is done. There are committees. People were speaking about my co-panelists, NABH. So NABH mandates, and otherwise also we have more committees than the mandate. We have some international accreditations which do standardization. So there is mortality morbidity committee, safety committee. Again, number of committees are there. These committee not only do the regular work, they identify the risks across the units, and then we do risk prevention, and that also entails patient safety and anything which relates to patient risk. The third thing which we have done is we have tried to standardize wherever possible. Though I said standardization is not possible, wherever it is possible, we have tried to do that. So one is right from the uniforms of the staff so that you can identify, to the layout of departments, the brands which we use of equipment, is positioning of brands, and it has been proved that positioning of brands, equipment and similar layouts lead to less error. So that is what we have tried to do. There is a common drug formulary across the hospital, which drug to use. We also practice antimicrobial stewardship, so rational use of antibiotics. Then we have credentialing and privileging of manpower, and majority of the good hospitals do. So what qualification is required to do what level of surgery and intervention, that is very much standardized. There are some regional aberrations, but majority of that is standardized. And then ultimately, if it's not in the culture, everything will fail. But the most important and difficult thing is to actually build a common culture. Now, we are still experimenting, but what has worked in our favor, I think, is that what you do is you cannot expect people who have joined from other hospitals, other places, or freshers to imbibe your culture. So we do is we try to have in-house training of people and promote current people who are second liners. We give them growth in our new hospitals, HODs. They carry the organizational culture and standardization with them, and they actually become change agents in the new hospital. Uh, all of this is only possible through a common digital backbone. Now, until unless, because we are in the digital age, until unless we have a common digital backbone, it is not possible. So, from common EMR, EHR templates to the backup systems, even the BI tools, they are all standardized across the hospital network, and they help us to standardize wherever we can and bring consistency to of healthcare to our patients.
Yeah, absolutely. As you mentioned, stay regularly connected with chains, clinics, and hospitals, as Kim's doing, helps maintain consistent quality across the entire network. Thank you, sir. Thank you so much. And finally, in the last, once again, I would like to come to you, Dr. Rashmi. You spoke about the AI telemedicine. Now, I would like to share your thoughts further. Ma'am, what changes are needed in hospitals to provide good, affordable, and accessible care? What do you think?
So the right now the problems with the hospital or the healthcare is there are three things. One is quality, second is cost, and third one is the accessibility. So as far as quality is concerned, so there are so many quality accreditations also which standardize the healthcare quality. Means NABH is there, NABL is there as we were discussing earlier, so that the hospital healthcare protocols in the clinical practices, the clinical protocols should be there. The equipment and infrastructure should be upgraded and the optimal to provide the optimal care or the good quality care to the patients. And as far as the cost is concerned, so we have to be very transparent with the cost pricing also. While counseling the patient, there should be no hidden cost for the patients, which is very important. And for to reduce the cost, we can use so many generic medicines as well. Even there are so many health schemes for by which we can reduce the cost of treatment. And the most important thing is where the government should also support is that as of now we are expending only around 3.2% of the GDP for the healthcare, which should be increased at least 5%, so that the healthcare should be affordable to the people. Because in India, the out of pocket expense is too high for the healthcare system, the medical facilities. But the hospitals, what the hospitals can do is they can be very transparent and they can optimize the treatment. They can use the generic medicines to reduce the cost of the treatment as far as possible. And the third one thing is the accessibility, for which we were discussing as the telemedicine is an option where we can reduce the cost of infrastructure as well. Means there is no need the pay for the patient to come to the hospital. We can provide them the consultation there at home. So the accessibility will be all across the globe. We can make the accessibility to all the people, tier 2, tier 3 people, tier 3 villages and the slum areas as well. And the 24 into 7 ambulance services should be there. Your emergency services should be quite good, so that the timely care to be provided within the golden period. There are so many diseases in which there is stroke and MI, where golden time is very important. You have to provide the treatment right on time. So for that, accessibility for the patients to reach to the hospital is very important, so that your ambulance services and the transport services should be quite good. Your telemedicine is very important in this aspect, so that you can connect to the people when they are at home, and when they reach the hospital, the pre-medication has already been provided to them to support them to reach to the hospital. So these are the things which are very important to optimize the healthcare system, to make it accessible to the people, and to improve the healthcare as a whole.
Yeah,
Yeah.
you rightly said, ma'am. That is very important. With the support of hospitals, treatment can be made affordable to the great extent for the patients. Thank you very much. And today's discussion clearly highlighted that the future of India's healthcare rests on the strong integration of technology, trust, and patient centric treatment. Our panelists emphasized how digital innovations, transparent communication, and accessible care can together build a resilient and inclusive healthcare ecosystem. The insights shared today offer a clear roadmap for creating smarter, more trustworthy, and affordable healthcare for Bharat. Thank you to all our speakers, Dr. Ravi Gaud sir, Mr. Prem Kakkar sir, Mr. Saurav Gupta sir, and Dr. Rashmi Gupta. Thank you so much for being with us. We are also thankful to our participants for joining today's session. This webinar is part of Amar Ujala Health for Bharat initiative aimed at fostering impactful healthcare dialogues across the country. For more updates on upcoming webinar and health initiatives, please stay connected with Amar Ujala. Have a great day and thank you once again.